Okay, and the number, well, we're still getting a trickle of new attendees coming in, but it's has flattened out. So I think we can begin whenever you are ready.
Okay, I see. Do I see we have about 39 people right now?
7 panelists and 32 attendees.
Okay. Well, then I'll go ahead. It's 2 minutes after 10 on Monday, the 21st of November. Hi, everybody. I'm Tony Newman. I'm with the Division of Senior and Disability Services. I'm coming to you from rainy Juneau, Alaska. And I'm here with my colleague, Lynn Cruz, and several others from Senior and Disability Services who are around the state. I'll let them introduce themselves if and when they speak up during the course of this hour together. And I'm also here with Steve Lutsky and Andrew Seslinski of HCBS Strategies, the consultants who've been working with us on this project and will assist with the discussion today. As the slide says, we are here to update you all on the plan for eradicating the intellectual and developmental disabilities waiver waitlist and update you on the cost estimates and the draft plan as we're working on it. And we are eager to solicit whatever input you may have as we go along. I'm going to turn here to our next slide. You see the agenda now? Yes. Okay. Just making sure. So yes, this is our agenda for this morning. If you didn't make the previous webinar on this topic that we held on October 24th, not to worry. We'll do a quick review of the legislature's request and what we talked about the last time before we share some of our newer thoughts with you on estimates we have and steps we need to take. We hopefully have people on the line representing the full range of people affected by intellectual and developmental disabilities. We hope there are people from with IDD, their family and friends, care coordinators, other providers, everyone in between. So given the variety of interests and familiarity with our system, we are going to do our very best to keep this conversation accessible to everyone at a very high level. So we'll do our best with that, but please let us know if you feel like we're moving either too fast or too slow. We're going to review the legislature's request, talk about the fiscal impacts and our estimates of that, and the steps necessary to implement the plan. And although we're going to welcome your questions and input throughout, we'll make sure to pause at the end for any discussion we need. All right. Reminder on how you can participate. There's a Q&A window on your taskbar for Zoom, and you can type a question in there, or you can use the raise your hand function on the reactions button as well, and we'll unmute you if you'd like to make your comment verbally. We do plan on following up this webinar with at least one more before we need to submit the plan on December 20th. And Steve or Lynn, anything else need to be mentioned in terms of housekeeping before we go?
No, not that I can think of.
Okay. All right. We showed this slide the last time we got together. This is the language in the FY 2023 budget bill that required the department to develop a 5-year plan in collaboration with stakeholders to eradicate the wait list for the IDD waiver and prevent other waivers from developing a wait list, and submit this plan to the legislature by December 20th, just a month from now. I want to emphasize that they've requested simply a plan. There is not a commitment on the part of the administration or the legislature to actually fund and support the plan at this point. All they've asked for is a plan that would show us how we would do it if we could. Okay. And by just quick way of review on the October 24th webinar. Yeah, we got together in October. We reviewed that language and how the current wait list works. And we put out for your consideration 2 possible approaches. You might remember we talked about one way to eradicate the wait list would be by simply telling the legislature that we needed them to fund all the anticipated expenses to serve everyone without making any substantial changes to our current process. And we call that the sledgehammer approach. And the obvious drawback to that approach is that it would come with a huge price tag and would also overwhelm our service system, leading to frustration for everyone, recipients, providers, SES. But we also put forth our ideas for a plan that would take a more surgical approach and that uses and accomplishes a couple of things. Things that you, our stakeholders, have told us over the years that you would like to see, and that SDS has wanted to see too. We call this the resource allocation approach, and it would create the possibility of a more flexible plan for services, enhanced beneficiary choices and self-direction, better budget predictability. So we heard when we came to you in October that the more surgical approach would be well received and would be also a more palatable way for us to approach the legislature with a plan that they could get behind. So in a nutshell, what we're going to do today is talk about some of the questions we need to ask to eradicate the waitlist using this approach. And really some basic questions. How many people do we need to be prepared to serve? What's that going to cost? And what confounding factors are out there that we need to be aware of? So what I'm going to do now is walk through these categories on the things we've determined to weigh to figure out who this plan is going to serve and how much it is going to cost. I'm going to talk about each of these boxes in turn, and I do want you to pipe up and let me know if you think there's anything we've overlooked. As we go through these, be aware I plan to pause, ask if what I've said makes sense before we move along. So let's take the first box, number of people on the registry. I mean, the place to begin in figuring out how many people we would need to serve if we eradicate the wait list is to first look at the number of people on the wait list now. When I'm asked out of the blue how many people are on the IDD wait list, what I typically say is there's about 500 people, but with lots of variability because of ebbs and flows in the number of people that are on. I think today, and Heather Cord is on and she can correct me, I think we have closer to about 425 people or so on the registry right now. So this number is a little bit of a moving target, and we do have to account for that. But in developing a plan to eradicate the wait list, we also need to recognize that we have people on the wait list who are both on and not on the individualized supports waiver. As of this month, I understand we have about 160 people who are on the registry who are not on the ISW and have not asked to receive ISW services. So to play it safe, given the fluctuations, we are assuming that 220 people on the registry are not on the ISW. And like I said, that's a little bit more than are on the registry right now, but we think that's a safer number based on historical patterns. Any questions or any comments about that, Steve, coming through?
Nope.
Okay. So another consideration in estimating the fiscal impact is the number of people on the ISW who want to be on the IDD waiver. Because the ISW was set up in part as a way to get resources to people on the waiver, we would assume that the ISW will go away once the waitlist goes away. Under our resource allocation approach, we assume that the need to have separate ISW and IDD waivers goes away as well. And so the 550 people that are currently on the ISW will transition off of it by 2028, which is the end of the 5 years we have to develop this plan. So, any questions or comments about that? Okay. Another consideration in estimating the fiscal impact, the number of people who might be eligible but are not yet on the registry. Last time we got together in October, some people mentioned their belief that there are people out there who are not signing on for the waiver at all because of the wait list, and they believe that there's really no point if they're just going to wait. So we need to find a way to figure out how many people are out there that would sign on to the waiver if they could, because there's no wait list. So while it's impossible to directly determine how many people would meet IDD waiver eligibility, Steve Letsky is doing research to help make the best estimate that we can. And right now, estimates that there are 2,341 additional people out there who could meet level of care and would enroll on the waiver. And Steve, I'm going to ask you a question now, not to put you on the spot too much. Is this saying that there are 2,300 people out there right now? Is this a point in time, or would there be a regular influx of, say, 2,300 people every so many years, every year, every 5 years? Can you give me a little bit more background on that?
But this is the estimate of the overall amount of additional individuals that we believe are likely to be served on the waiver. So it is, if you were to open it up right now, if we were able to serve everybody who wanted, and they didn't have to go through any process of enrolling, and they didn't have to find any new providers and stuff like that, the current number of people that would be served would jump from where it is now to add this additional 2,341 individuals.
Okay.
Yep. So it's kind of, a one-time grouping, and then from that, there's, as you move on, there would be some new people that would come in, and then some of those people would drop off, as you have with your current waiver populations.
Okay. And I remember last time in October when we got together, before you'd had the opportunity to look at this American Community Survey and look at other sources, we put up a number, I think, of 18,000 people possibly could be out there, and that seems it seems now that you're saying that that's a way overestimate. I know you didn't have anything to work on then.
So we had to adjust the estimates based on other factors, because there was 18,000 people who had intellectual disabilities. Then we found some particular items from the American Community Survey that seems like it would be closer to the ICF IID level of care and DD determination criteria that Alaska uses. So that would be a better estimate. Then we had to think about that not all of those people would be enrolling, that it would just be a certain percentage of those that are likely to enroll. So we had to develop some assumptions around that. And from that, then we got to the number of what we're using for the assumption of the additional people that will actually enroll.
Okay. I was doing research for something else a couple of weeks ago, and I came across the American Community Survey being used in another report having nothing to do with IDD. It had to do with seniors and services they were receiving. So this, who puts on the American Community Survey?
So part of the Census Bureau and the U.S. government does it.
Okay.
So it gives you more detailed information about a variety of different factors. And if you use a 5-year estimate, it results in statistically reliable estimates at the state level.
Okay, thanks. So yeah, this is the figure that's sort of the area where we need to sort of do the most research, isn't it? This is the real question that's out there that we have to account for, because we're just not sure who's out there who would like to be on the IDD waiver, who's not even attempting to get on it right now.
Yep, and we have done all of this research, and we've run it by other individuals, including representatives from the trust, who have tried to figure out these numbers beforehand to come up with something that we think will be reasonable.
Okay, are there any questions or comments from anybody else?
There's a question from Mariana. She was asking if the ACS estimations also take into account the people would be eligible based on the financial eligibility requirements. In terms of the financial eligibility, because Alaska does have the TEFRA option that allows you to be treated as a family of one, we're assuming that all of the kids would probably meet the financial eligibility. The same thing with adults, that most adults who have intellectual disabilities that are substantial enough to meet Alaska's DD determination, we're assuming that they would have a low enough income to be able to qualify for the waivers. So we did not take out additional people because of the financial eligibility requirements.
Good question, Mariana. Anything else? All right. All right. Another consideration in estimating fiscal impact. The current waiver participants are selected now because they have the highest needs. So as we add people who are on the wait list or not yet on the wait list to the waiver, the costs for those new people should be less. As we stated last time, one thing that we think is important is that in gradually eliminating the wait list, we would move people off according to need, which would be as indicated by their DDRR scores. But the plan is that by 5 years, there is no wait list and everyone is off. Okay, so given that we know that the lower the score, the lower the need, by the time we are ready to implement our resource allocation approach, in which people are assigned to tiers of service relative to their need, the people with the currently lower DDR scores should pose the lowest costs to the state. So that's another assumption that we're making as we go forward. No questions? No comments? All right. And then how quickly will the number of people on the IDD waiver increase? This is another important consideration to go into our plan. We would increase the enrollment shortly. Let's say the legislature likes the plan, wants to do it, and passes a bill and a budget that allows it to happen. So what we would do at SDS, we expect we would increase enrollment shortly after the legislature passes that legislation, and then steadily increase the enrollment over the 5 years that they've given us to do that. We assume that once it's clear that the registry is going to be disappearing, it will actually conversely grow as people learn that the wait list will be eliminated. So as the registry is in the process of being eliminated, we're going to assume that it's actually going to grow in number as people realize that they can perhaps they would be able to get services, whereas they would not have in the past. This assumes that additional people will apply for services once the wait list has been eliminated, since they don't have to go through the DDRR process. It will take time to enroll and serve these new people. Outreach will need to occur. Care coordinator capacity and other provider capacity would need to increase. SDS's capacity to manage more folks through and getting services would need to increase. And that's why we appreciate that the legislature recognized that this would sensibly be at least a 5-year process to make this happen. And I see a question from Representative Andy Story there. Does reducing the wait list require substantive legislation in addition to budget increments? There is, and Heather Court is the most familiar with this, but there is the Alaska statute does include reference about the wait list and how it will be managed. So I believe that any change to that process or elimination of the process probably would need to be accompanied by eliminating language in a bill. Does that make sense? I see Heather nodding. You're on mute, Heather, but.
Yes, that's correct, Tony.
Okay. And Steve, did you have something to add?
Nope.
Okay, no other open questions?
Nope.
Okay. Another consideration that we're weighing in and estimating the fiscal impact. Changes to how SDS operates could control the costs. We've talked about how we want to implement a new assessment tool called the INRI to make it easier to enable the resource allocation approach. We're also talking here about evaluating and potentially refining our current eligibility determination processes up front. We haven't gotten very far down the line on that conversation, but we're just exploring whether or not our current eligibility determined process would need to change. And that's just a conversation that I believe can continue even as we submit the plan, right? We don't need to have those details sewn up entirely when we submit the plan to the legislature. So that's safe to say, isn't it, Steve?
Yes, we're including in the plan the addressing that and determining if the changes need to be made and incorporating that into the timeline. Of course, if no changes need to be made, that would make it much simpler to implement.
Right. Okay, not seeing any questions. I'm going to move on. All right, so taking all of that into account, here are the draft estimates that Steve and Andrew have put together for us and that we are working on off of right now to determine how much this plan would cost. The written plan that is being developed will provide the details that go into these elements, but we wanted to provide you with an overview that wasn't overwhelming here in this webinar. So what we see here is the costs to our plan and a timeline that takes us from a proposed start in 2024 and out to 2028, all on the top line. So the top line is 5 years. But we also stretched out another several years on the second line to show how, once this approach to managing the waiver is up and running, that we do expect the costs to sort of flatten out around $63–65 million when we're several years out, about 10 years out. So the baseline number, I want to explain the baseline there, that number in the black box that says $90,808,000. And where that number comes from is that we spend roughly $180 million in 2021 combined federal and general fund spending. So you cut $180 million in half to allow for the general fund portion, you get $90 million. So that's where that number comes from. And all these numbers stretching across are the estimated costs in general fund state dollars. And those numbers, the 8 million here and the 19 million in 2025 represents an increase to that $90 million in GF that would be needed, general fund that would be needed. And I want to call attention to this important footnote down here, that this model assumes that between 2024 and 2034, 3,111 new individuals will enroll in the IDD waiver. And when factoring waiver attrition, 4,169 individuals will be enrolled on the waiver by 2034. Because on average, newly enrolled individuals would have fewer needs, the average participant cost drops from $89,000 in 2021 to $73,000 in 2034. Okay.
Okay. We have a few questions coming in. Abby Bingham was asking about how much time and money would go into a new assessment tool. What is it about the ICAP is broken and needs to be fixed with a new assessment tool? The ICAP is a fairly old assessment tool, and the process of assessing individuals with disabilities has advanced substantially since the ICAP was developed, I believe about 40 or so years ago. So the INRI tools are more state of the art and are collecting better information. The ICAP was never intended to be a tool that would be used for assigning resource allocation And the way it's working now in Alaska is it's not really establishing the eligibility determination. Most of the people, or pretty much almost everybody who meets the DD determination process also meets the threshold set by the ICAP. So it's not serving a special purpose for it. Hence why using a more newer tool that does have some experience being used for assigning eligibility and assigning resource allocation is felt to be to provide a stronger basis for that.
Yeah, thank you, Steve. I always like to draw an analogy. The ICAP is an older tool, and you know, it reminds me where we are with it in terms of using it for a resource allocation approach. Reminds me of when my computer breaks down, is 10 years old, and I take it into the store, and the repair guy says, well, I can repair it. It's going to cost you almost as much to repair as it would to just get a new tool that will do a lot more of what you need now. And so that's sort of an analogous situation that I think we're in with regard to why the InterRight tool would make sense as we move forward.
Okay. Then Christine was asking how many Alaskan Natives are on the wait list and all other waivers currently being served. Since they are funded under the 378 tribal claims at 100%, there would be no fiscal impact for the direct services for that. And Heather, I don't know if the wait list or the registry includes information about if they're covered by under the tribal and eligible for the 100% match.
So in the yearly report that we provide to the legislature that's available on our website, we do keep track. If an individual does indicate that they're Alaska Native on the DDRR, we do track that, but of course it doesn't go down into any more specificity than that. In FY21, there was about 22% of the people that were on the registry who indicated that they were Alaska Native.
Okay.
Let me just say I appreciate Christine's question. It's a good question. And Steve, are you, as you make your estimates, are we going to be taking into account the fact that there is a 100% federal match for Alaska Natives who are referred through that, you know, tribal claiming way?
Nope. Actually, we will take a look at that. Thank you. That's very good input, and that's very helpful. Okay, we have one from an anonymous attendee. We need to change the regulation that says the parents and of minors, guardians, POAs, and spouses who cannot provide waiver PCS services to reduce the historic ongoing lack of staff. We heard a lot about that at the last webinar in terms of increasing flexibility and making other changes within that. We have incorporated that into the work plan, not the specifics on it. We've incorporated a task to be looking at how to make services more flexible once the resource allocation is implemented, and allowing these types of changes would certainly be a way of making it more flexible and allowing more people to be using it. Okay. Kim Champney was asking, are the cost estimates based on existing services? Was thought given to the existing service options, i.e. the participant direction, technology, remote support, and other supported living options? So yes, the cost estimates are based on the existing services. We did a fair amount of analyses on that to develop the cost, those cost estimates for that. Because that's the only data that we really have available to try to develop those costs. We did make assumptions to adjust because we're assuming that the population will be less expensive than the current waiver population, because the people who are selected for the waiver now have the greater need, as you know, determined through the DDRR process. In terms of like the additional service options that may result in more cost effectiveness and so forth, we're anticipating that that would be implemented along with the resource allocation approach, and that would allow you to become more efficient, so that as you're doing the resource allocation and getting some savings, you give some more flexibility and allow that people to use more or different approaches that would allow them to save some more funds. So the thinking is incorporated into the plan, and it does account for some, it does reduce the cost estimates by having that done hand in hand with the resource allocation approach. Okay, Allison Nielsen Brandt was asking, are there certain disabilities that would have an automatic approval for the waiver? And I don't know if Heather, if you would want to handle that or if you would want me to.
I guess my initial response is everyone would have the same process. We can't apply different criteria for different individuals with that regard. So I imagine everyone would have to go through the same application process, but it would probably be similar to how it is now, in that, you know, what we require for documentation may differ depending on the person's diagnosis. You can add anything if you have something, Steve.
Nope. I think that makes sense. Christine was answering, so that wouldn't remove individuals who are currently supported. And I don't know if I'm understanding your question, Christine. Did you want to, I can unmute you if you want to just ask that directly. Okay, you should be able to talk now, Christine. We're not hearing you if you're talking. You might be double muted.
I have to wonder if what she's asking is, if we make changes to our eligibility determination process or use a new assessment tool, does that mean that people who are currently eligible could potentially not be?
Now, that would be part of the process to make sure that that does not happen. We think that you do have a very thorough DD determination process within that, but it goes hand in hand with the DDRR, that if that were to be changed, we don't know if any changes are necessary. Part of monitoring the new enrollment would be to see if there was any changes that potentially would be needed. If it were to be changed, we would anticipate, or the work plan anticipates, that there would be a modeling effort to make sure that nobody who right now is enrolled and has met the threshold through the DDRR process would be eliminated. We did a similar effort with the state of Colorado, and were able to set it up so that they had to replicate and replace their whole eligibility criteria. We were able to set it up so that nobody lost eligibility.
I hope that that I interpreted your question correctly, Christine, but obviously weigh in if we didn't.
Yep, and she's saying that is correct. I'm seeing that in the comments. Okay, Patrick was asking, does the model assume any changes on how you currently do business with the waivers to implement potentially cost-saving opportunities such as self-directed waivers using enabling technology and mods and so forth? And this seems like loosening background checks and allowing family provider services. Patrick, the same answer that we gave to Kim, that the model includes some savings that's attached to the resource allocation methodology, and the assumptions being that once the resource allocation methodology is done, that services would be made more flexible and that you could be incorporating some of these other potential cost-saving approaches. Okay, Allison was asking, have you compared the estimated cost of waiver services to the current cost and fiscal impact of having a family member with a disability on families and the cost of having to place an individual with IDD, the cost of having to place an individual with IDD out of state and the cost of the placement within a nursing home. So in terms of the cost estimates for the current ones and having to serve the families. Actually, hold on, let me take one step back. We are not assuming that there's savings, that there's individuals who right now are being served out of state or who are in a nursing home would be able to go onto the waiver, because all of those individuals would automatically have priority for a waiver and would be able to have a waiver slot now. So there shouldn't be any savings within that. If there are some individuals who are being served just by family members, if the family were to be breaking down and not be able to provide adequate support, the current DDRR process should be prioritizing them and allowing them to access the waiver. So we don't think that you would have any of those individuals that would be shifting over and potentially saving those other costs. There are likely some costs that are being incurred directly by family members. Either they're paying out of pocket or they're providing all of these services and having no supports and sacrificing being able to work and so forth within that. Unfortunately, that's something that we couldn't develop any cost estimates to, and two, it's not direct savings to the state, it's savings to family members. So that's not factored in as any additional savings. Okay, Abby Bingham.
Steve, why don't we're going to get to some of the timeline that we have in mind, and maybe we can come back to that question then.
Okay.
And
yeah,
Abby, bear with us a little bit longer because we have some a slide on how this would unfold time wise. Do you see any other questions, Steve, that are on this slide?
Yeah, well, Jean's asking, this is the question about the getting rid of the medical negative DDRR, and what will be the selection criteria. The process would be eradicating the wait list so that there would not need to be a DDRR process, and the sole things that would be determining is whether somebody would be eligible for the waiver would be whether they meet the DD certification process and whether they meet the level of care process for that. So it wouldn't rely on the DDRR, that would no longer play a role.
Heather, anything to add to that? That's sounds accurate to me.
Yeah, that's accurate. And part of that question was, would there be a change in terms of, would people be drawn based on how long they were on the wait list? And this is sort of an aside, but I do want to offer that if this plan doesn't go through and we sort of move towards this direction, for the ISW waiver that's intended to be at capacity within this fiscal year, at that point that program does reach capacity, we would implement a wait list for the ISW program. And there would be a difference for that program in that a person wouldn't have to fill out the DDRR, and we would draw based on how long they've been waiting. So that's a change that's coming, if this report doesn't move forward. So just as an aside, we are focused on that and trying to find areas where we can reduce the burden for families outside of this effort.
Thanks, Heather.
Okay. And the last comment or question asking about if SDS has started a conversation on how to add more care coordinators to the workforce and to assure that all these individuals can actually receive services by 2034 with an average caseload of 20 to 25 clients. The need for care coordinators were almost double what it is now. We do have a lot of concern in terms of the provider capacity and kind of trying to ease up the growth of the provider capacity, hence why we proposed rolling in and increasing the enrollment over a multi-year period to help to address that. And that's the primary way that we have addressed that. That's it. Go ahead.
I was just going to say that's a major and important question that several people have told me. How are we going to, in this waitlist eradication plan, going to include funding for more providers, more services? And it's a difficult spot to be in. We've been asked by the legislature what it would take to eliminate the plan and provide services to people who aren't getting them now. And yet we know that the system needs to be improved and expanded and strengthened for that to happen. How far out we go in estimating those costs is the tough question before us. So shall we move on and talk about the steps here? Next, we're going to talk about some of the things that need to go into place to eliminate the wait list. And Abby, we're getting back to your question. So we're going to show some of the tasks that we know we need to do and how they're related. And so in a way that complies with the requirement, the wait list will be eradicated within within 5 years. So right now I'm going to review the major tasks that we see as part of the plan. Here they are. I don't have separate slides for each of these, but I will talk about these. You've already heard us talk about the first box, implementing the INRI, which is a suite of new assessment tools that we would use to help us do better resource allocation. As was indicated, or a question came in earlier today, and there was a question last time about what about continuing to use the ICAP. And I think we've talked about why that would be challenging to try and adapt that tool into the new paradigm of resource allocation. So,
yeah, and I want to add, Tony, one more thing just about that is that when you're creating a new resource allocation approach and you're starting more from scratch, that you don't have an existing methodology in place, that's significantly easier than from changing from one approach to another approach. So a lot of states have, like, there are many states that actually have ICAP-based approach or approach based on another methodology that was developed years ago. When they're wanting to switch to a new approach, it's much more complicated because the old approach, there's always going to be winners and losers from the old approach. Even if the old approach was kind of inaccurate, and a lot of the times that was awarding money based on things that didn't make sense on it, that when you switch to the new approach, many of those people will view themselves as losers, and in fact their budgets will be lower. So it becomes much more methodologically and politically complicated to go from one approach to a new approach. Hence, so trying to start something right away with the ICAP and then switch to something based on a stronger tool and a stronger algorithm would probably make it just significantly more complicated and politically challenging and more disruptive for individuals.
Yeah, this is Lynn. Can you hear me?
yes.
Yeah, I was just going to say that I want to reassure people that this doesn't happen overnight. So the resource allocation approach can only happen after you have collected some data, so that we can set good algorithms and we're not creating issues for the people that we currently serve or people in the future. So it's a very thought out sort of plan to use the data from a new tool. And so the INRI is just has a suite of tools that we think are appropriate for all of our waivers, which is different than using the ICAP or the nursing facility level of care tool and the other waivers. And so the eventual approach would be to use the INRI resource allocation, or the INRI suite of tools for all of our waivers. And I just want to remind folks that we did do a whole analysis of assessments for folks on the phone that maybe did not know that. We did it with stakeholders. We hired a contractor. This was several years ago, and the choice of all the tools that we researched was the INRI.
Yep.
So,
and the ICAP was one of the tools that was explored at that time, and
correct.
was
Correct.
not chosen.
Correct. Thanks.
And Lynn, just for people's benefit, what was it that sort of interrupted that work that we were trying to do toward adoption of the INRI? Was it?
Yeah, well, we actually had started with our nursing facility level of care, and we were doing sort of a pilot where we were doing our regular assessment and we were doing the INRI assessment, and we were working on those elements that we would work on in the future for this particular waiver, to make sure that that our eligibility criteria sort of transferred and that we weren't creating a big set of people that wouldn't then qualify. So we did a lot of research in that, but there were several things that we had to direct our resources towards. One was the ISW waiver and community first choice. We added those two things in the same time we were trying to do that pilot. And then of course, we also had the pandemic hit. And so it really set us back in our timeline for trying to implement INRI. And this is one One, has always been sort of part of our plan to still go towards NRI. It's just a matter of timing and resources. Does that answer your question, Tony?
Yeah, thank you.
Mm-hmm.
Thought it'd be, you always bring great historical background to why these things happen the way they do. So thanks. Steve, I'll go ahead. I see we're getting a little bit on time. We do have an hour together, right?
No, it's an hour and a half.
Oh, okay, great. So these elements, as I go through them, are things that we recognize need to be part of the consideration. I will acknowledge that we don't have in every case a lot of plans sewn up and steps sewn up securely. So for instance, the second one, updating the assessment support planning automation. We know that we're going to need some technological assistance in updating our assessment tool and what that means to our Harmony system, whether it would be an adjunct to it or a replacement of it, is just something that we're still talking through, but we recognize it needs to be an element of this. Like we said earlier, we're exploring the current developmental disability determination and level of care processes. Not sure what sort of changes that will result in at this point, but we do want to look at them. And as Lynn said, we want to make sure our processes are maintained as closely as possible. We want to create more flexibility, but we also want to be careful that we're not making changes such that they're disruptive to people. Developing the resource allocation approach is going to be an element of this, where we talked last time about the tiered levels of services, or as Lynn likes to call them, bands of services, whereas the most intensive needs get the most assistance, and those with lower levels of need get less assistance. And exploring making services more flexible, the possibility of adding more self-direction, self-budgeting. Could be new services, flexibility to existing services. The hope is to give people more control over their budgets. This plan, this surgical approach, we're convinced lays the groundwork for those things to happen in the future. So that's the goal. That's one of the exciting things to me, probably the most exciting thing to me, that we could think that we could both eradicate the waitlist in a way that creates more beneficiary choice. Is really exciting. So and these things take time. There would need to be, I saw a question earlier, yes, there would need to be changes to the waivers that we have with the federal government. We would have to change regulation. We talked about changing statute. Regulations process in alone is often a 12-month process, so that's going to take time. But on the good side, there will be opportunities for continuing input. If we change regs, we would have to go through a public comment period, right? If there's legislation that needs to change, that obviously is going to go through the public process over there in the Capitol. So though these things take time, there will be ongoing opportunities for input to inform almost every aspect of it. I'll pause there, Steve, and see if there's any questions we would want to address.
Okay, so I'll go to Abby's question about when would the new assessment tool be put in place, and how whether that would have any impact on people's existing services on it. Yeah, we have then the new assessment tool planned out for like 2024, that it would be rolled out. In terms of the impact on people's new existing services, it shouldn't have any impact on it. We have another question that I'll address at the end. It's going to require a complicated answer, so I'm going to hold that one until we finish all of the slides and have other questions addressed. Okay.
So I've gone ahead to this key milestone slide, in part because it puts a more specific date on Abby's question. But the key milestone, let's assume that we get our plan done on time on December 20th, and it's in the legislature's hands for their new session beginning in January. This legislation authorization provided by May 2023 2023 is sort of a best case scenario. As you know, the legislature often doesn't get close to finalizing its budget and plans until sometimes closer to June of a year. So maybe the authorization would be provided by June or July 2023. Or maybe they would take the full 2 years of a legislative session and it wouldn't be authorized until May or June 2024. Or it could be never. I mean, this is just a sort of a hopeful, if the legislature were to pick up the plan and run with it, this is what could occur. A new IDD assessment tool in place by November 2024. That's ambitious, but as Lynn indicated, a lot of work has gone into looking at the NRI and how to incorporate it into SDS. Potential changes to the DD determination and level of care processes, that would be ongoing by January 2026. Resource allocation approach in place by October 2026. And then with the waitlist eradicated by May 2028, that gets us to the 5-year goal that the legislature has put on us. So I was going to say the things that we've talked about, like, you know, self-directed budgets in there, that will be probably part of a phase 2. We definitely want to be pointed in that direction, something that would need to be done. But having fully self-directed budgets, probably something that would take beyond 5 years is our current thinking. I mean, you know, would qualifications of providers need to change? Would we develop tiered rates to manage acuity? Would additional services be brought online? Those are things that we would like to see in the longer term, but to get toward the 5-year goal of eradication of the wait list, we are right now we're noting those things, but we're not going into too much details on that as our current plan. So I see a question from Abby now. Do we want to take this one on, Steve?
Sure.
Go ahead.
Yeah. So Abby's saying the concern about the resource allocation is that some services are simply not available because the agencies do not make any profit with the current rates. For example, I was recently helping a family look for a group home for the child because that's a service that they can get fulfilled, while less expensive services like day have, respite, and supporting living cannot be fulfilled by the agencies. The resource allocation process should not directly affect it by making it better or worse. It will go hand in hand with additional flexibility. So you'd be able to look at other potential services. And one of the flexibilities that could be explored is allowing for some flexibility in the rates that are paid. That said, the major thrust of this is probably going to be in some of the rate rebasing and the work that SDS and the department is doing around that to try to make sure that the rates are adequate to attract a sufficient number of providers. So once again, the resource allocation process hopefully may be able to help ease some of those components, but there's nothing inherent in it that should make that any more difficult. Other questions or comments?
I put up this next slide just to sort of a footnote to this entire presentation, that we will propose that this plan be flexible in case of high costs, delays, more time is needed. This being government, we recognize that things don't always go according to plan. So we're going to be asking for some grace. Just in our plan that we provide, putting in some caveats to note that we would like flexibility to be a critical part of the plan, just given how challenging it can be to make a system change this major.
Yeah, Tony, this is Lynn. I would just add to that. I think I said it in the first presentation that understanding that 5 years is a long time in the life of a family or recipient, but for resources to make this big of a change, it is very difficult at the state level to get things through, even as fast as we try to work on these types of things. And so this is a really aggressive plan. And we're committed to it if it gets approved, but I would agree that it is difficult. And that's why we say when we're talking about those, self-direction, the way that some people think of self-direction, that really would probably be more in a phase 2, but we have to set up all of these parameters to really get there. And we're hopeful that we can get it done.
Okay.
Excellent.
Abby was saying, does SDS foresee people who are already living in a group home but potentially have a lower level of need being displaced from their home? The model does not assume that. It doesn't assume that there's going to be any reductions in costs from people that are currently being served. When the resource allocation methodology is set up, that's one of the considerations that we would want to be having in there to make sure that the people who are currently having services are not having negative impacts or trying to minimize any kind of a negative impact within it. Okay, and Allison was asking, with the current employee shortage in Alaska and the nation, how will we be able to get DSPs with the current wage? People make more living at McDonald's. And SDS is currently engaged in rate rebasing and trying to set that up for it. So, I think that's something that SDS is already taking very seriously and looking at very seriously. It's not something that is incorporated into the model other than allowing for a large period of time for provider capacity to be increased and recognizing that it would take many years. We have this projected out over a 10-year period for all of the new people for the capacity to be built to serve all of the new individuals.
Yeah, it's another great question. I hear from people who say, getting rid of the wait list, love it, love to see it, but I'm really concerned that the provider base is not going to be there to serve people. And I would just say that you'll have opportunities when we present this plan to the legislature. I would say it would be great for them to hear from people who say, well, getting rid of the wait list, great, but there are other elements beyond getting rid of the wait list that need to happen to make sure people are served well. And you will have opportunities to share that with your legislators, with us, and hopefully have a good, robust dialogue on these points.
Okay. And John was asking, do you plan on any tribal consultation prior to submitting the plan? Very impressive and aggressive plan. Tony, I don't know if you want to address that.
Well, tribal consultation is an important and a really valued part of the feedback that we get, and this is basically the consultation we're doing now with everyone. There are requirements, for instance, when we make waiver changes or regulatory changes, that there be tribal consultation. Jetta may correct me if I'm right on both those points, but this did not make that requirement. We wanted to just, given the short time frame, we wanted to get the development of the plan to this point out to as many of our stakeholders as we could. So this is the way we're doing it. Jetta, did I get that right with regard to tribal consultation and waivers and
yeah, both of those do need a 60-day tribal consultation period. And so when we are ready to release them for public comment, that will also start the clock on tribal consultation. But we're a ways out from that still.
Yep. But the plan does include time for that tribal consultation and the other public input processes to be incorporated before any changes are enacted.
Right. If we're going to be, Steve, in other words, if we're going to be making changes to the waiver, it would be accompanied by the need to do tribal consultation.
Yep.
Yeah.
Yep. Yeah. So we have the one remaining question from an anonymous attendee. For the person who put the suggestion out there, if they're willing to identify themselves and raise their hand and just kind of ask it, because to clarify it. Otherwise, I'll take a shot at trying to answer it. But if you are, I see somebody is raising their hand. And we get to it. Or Kim's raising her hand. Go ahead, Kim.
Can you hear me?
Yep.
Okay, I don't know what the question was. I didn't put a question in. I just really wanted to respond to the provider capacity concern and ask a question or just put it out there. AADD, so I am speaking as the executive director of the Alaska Association on Developmental Disabilities, but I'm also speaking as a partner with Key Coalition of Alaska. I know Michelle Giroux, who's the president of Key, was hoping to be on today and she wasn't able to, but you know, Key has been advocating for eradicating the wait list for decades and decades. And AADD and Key are super excited about this opportunity. And as AADD and providers, I totally understand Abby and Allison's concern about how are we going to serve people. And so, and you mentioned rates, and that's important. I guess one of my questions is this plan an opportunity to educate legislators about the different aspects of the system that have to be fixed in order to eradicate the wait list? And I would just want to plant the seed that there be at least some description around, yes, SDS will be implementing this resource allocation tool, which is a key component, but there are also, if we don't add flexibilities into the system as we're also working toward resource allocation, we are going to end up with that frustration in the system, because we do, even with money, even with rates added into the system, we won't have enough workers to serve everybody. And so AADD and Key have some specific thoughts about that. We will email to you, but I just wanted to point out and encourage, if SDS needs capacity building around this, I think that you're going to find a lot of advocates reaching out to legislators this session saying, this is the time and this is really important to invest. And so I would encourage SDS to think about what would it take to do some parallel work, not just on resource allocation, but also on building our system for the future at the same time. And I know that's a heavy lift, but I just wanted to put that out there. Thank you.
Kim, you'd said that there was a question in there. I'm not sure what the question was, but I really appreciate the comments. And we have been talking with Steve about how do we get those sorts of other system improvements into the plan without it becoming overwhelming. But we certainly recognize that that's what we need to, that we can't ignore all of those system needs as we go forward. And we just want to strike the right balance between getting them in. And yeah, I see your question now. Can we include the system improvements in the plan? I would say that's the intention, is to at least talk about them. The question, I think, and Steve, you can flesh this out, but I think we're trying to strike the right balance between how deep to go in the system improvements and how specific to get on them.
Yes, yeah, and in the draft work plan, or the draft outline for the document that we're creating to share with the legislature, we're starting out talking about with some of the challenges with eradicating the wait list, and such as the workforce and the capacity is a huge issue. We also got some emails in about how this potentially might be even more challenging for people who are complex to serve, because providers will want to serve the people that are easier before they serve these more complex people, so it could exacerbate that. So we're planning on addressing that as a component of it. The approaches within the systems improvements includes like having better data through the NRI, having the resource allocation, having the greater flexibility, and providing people with more flexibility. Those are all components that would be put in the plan. Again, that it would be put at a higher level. The actual details about how that they would be fleshed out would be part of the work of actually implementing them.
I want to follow up also on something else Kim said about this being an educational opportunity. I'm excited about I'm excited that the legislature has asked for a plan to eliminate the wait list. That's exciting. I'm excited that it gives us an opportunity to point our system in a way that will allow us to make some system improvements. And third, I'm excited because it's going to be an opportunity for us to get in front of the legislature and talk about SDS and and IDD and our service array and where help is needed in it and how they can help us. It's going to be a legislature that's going to be very new in many ways. Lots of people aren't coming back, including some people who've really been champions of eliminating the wait list. So it's an opportunity for us to greet a very fresh audience, I think, to talk about our system and hopefully familiarize them and make them comfortable in working with us on our system needs.
Yep. And Jenna and Tom Crafton said, you know, my needs are so simple and not expensive. It should be easy to grant a waiver. Maybe some people want less expensive but helpful services, but not canned. That's part of the idea of having the resource allocation approach within it. So you would have individuals that would have lower budgets, but doing that in conjunction with making the services more flexible, as the stakeholders pointed out during the last seminar, would allow that to be happen and be able to meet the needs for individuals such as the Craftons. There was an anonymous attendee that said, I don't think that given the current financial state of the Alaska economy, that a $65 million incremental cost increase will fly. Is this an all or none of the plan? We are thinking about including some language that might say that you know, the legislature could, if they're uncomfortable with that amount, give STS the flexibility for adjusting some of the eligibility and the resource allocation and the other tools to try to be able to make the plan more affordable. It would mean that, like if you adjust the eligibility so that you're able to kind of adjust that up or tighten that up for certain individuals, that it would be fewer people that would be served, and making the resource allocation approach tighter than what we proposed, which we have not proposed making it, you know, a dramatic savings from it. But that resource allocation could be done in that way for it, so that we are talking about potentially putting some language in there that would potentially allow that. So it's not necessarily going to be all or nothing, but that's going to be up for STS's consideration.
Yeah.
This is Lynn.
Go
Oh,
ahead,
sorry.
No, go
I
ahead.
was just going to say, but part of that is the reason that it is difficult to add in everything that could possibly be fixed with the system. And I'm not saying that, you know, provider resources aren't an issue, but that's the fine balance we have with trying to get a plan approved to even move forward in one way, is to sort of try to keep it a simple ask at this point and build in some of those caveats that might be needed in the future. It's just a difficult and costly venture.
Yeah. I just wanted to say, you know, thanks, Anonymous. That's why we put last time before you an approach that would simply take a sledgehammer to the wait list and ask the legislature for something on the order of $150 million, which we didn't think was realistic at all, and many of you agreed with us. So it is a price tag. For sure, but as Steve is saying, that we are proposing a surgical way to approach it that is less costly and dramatic than just simply and I think irresponsibly just saying we can eliminate the wait list if we just had you know, $150 to $200 million.
Okay. So. We've got an anonymous attendee saying that, can you answer this again, please? I'm not sure which questions that's referring to. So if the person who either can type in more clarity as anonymous or raise your hand, we'd be happy to unmute you so you can ask the question directly.
Steve, I think it's the one where they're asking how many people would potentially want the IDD ISW. Did they post that again, perhaps?
You were holding off on.
Oh, the question of the earlier one.
Yes.
Okay.
45. Yeah.
So yeah, on that one on there, so I guess the person has not raised it, so I will take an attempt to answer it. I'm going to just read out the question. The suggestion is to find out how many people who would potentially want the IDD ISW. Think of it in terms of how many waivers, create a survey for unpaid caregivers and ask them what they do to care for the family member with IDD, how many hours per week, what care is given, define the services like the ISW IDD ones, and use layperson language to ask, and then take the results and divide it by how many of the ISW IDD waivers would cover the total unpaid caregivers do save the state money. The major challenge with this is that the people who we have the least information about what they're going to cost are the people that are not currently in touch with the SDS system. So they're not on the ISW, or they're not actually on the registry. So these are like the people that are out there that we know are out there, but are not, haven't entered the registry because they don't know about it, or they know about it and they know it's going to take too long, so they've never entered any information for them. So trying to, yeah, go ahead.
Sorry. And just a reminder that it is really about the short, very short timeline we have to get a plan to the legislature.
Yep.
So though it is a fact that unpaid caregivers save the state money, we do know that. And but it is very difficult at this point in the plan here to do this kind of survey and get results back and actually put it into the plan.
Right. Right. And I'll just say that's been a major challenge for us. I think to myself that if we had more time, it would have been great to establish sort of a task force with wide representation around that we could take a good year and develop a plan that was as thoughtfully and considered and as participatory as possible. But as Lynn noted, we had a tight deadline. That's been a challenge for us all along, to be as collaborative as we can be and still meet our deadlines. So what we thought we would do next is just do a temperature check through some polls. We wanted to just see how we're doing and invite you to just respond to a couple of questions so that we can gauge what we might try and do a little bit better in this last couple of weeks we have. So Steve, can you go ahead and launch those?
It is launched. You should be seeing a pop-up window with the polls on there. If you can go ahead and then enter your answers on it.
And I'll just to hopefully be helpful to somebody, I'll just read these. So the first question we wanted to know is, how comfortable are you with a plan to eradicate the waitlist as presented so far? And second, given the tight timeline, what additional ways could we make this process more collaborative at this point? And third, are the steps we've proposed to eliminate the waitlist too detailed? Would you like to see more detailed, or are they about right? And like I said, this is just sort of a temperature check. And if you find yourself answering to one extreme or another, if you think that it's been too detailed, not detailed enough, please follow up. And I think we're going to give people a direct opportunity to share some insight with us, right, Steve?
Yeah. Yeah, we're also going to be having a survey that will come at the end of this. So if there's anything else that you want to tell us and share with us, you can respond to that survey and give us that information.
How's it going, Steve?
Okay, let me see. We've got 26 of the 38 people have responded, so 68%. But the response rate is slowed down, and you never get 100% even on these ones.
Well, please vote. Remember, it's your responsibility.
Like, you nudged 5% of more people to vote based on that. We're up to 29 of 38 people having voted.
I see Jenna's, do I get a sticker for voting? That's great.
Okay, I think I'm going to go ahead and then end the poll and share the results. So, Tony, you want to walk through this? Or you want me to walk through it?
I can just observe, say what I'm observing here. I see things skew toward number 4 is the most popular answer to number 1. So somewhere between not sure and very comfortable. Did that have a comfortable label on it, Steve? Number 4?
Yeah, no,
Okay.
that's positive. There, overall, people seem to be comfortable with the plan as presented thus far.
Okay, so if we were to implement ranked choice voting here on our poll, it sounds like somewhere between not sure and comfortable would carry the day. And I get it. You know, this is a lot of information. Trying to present it in a way that's accessible to one and all. It makes a lot of sense to me that we would see people responding heavily with not sure there. So that to me just tells us that we'll want to just do what we can to make the language plain, to make the steps clear, and we will endeavor to do that. Anybody else have any observations about number 1? Okay. Given the tight deadline, what additional ways could we make the process collaborative? Process is about right. It's more presentations. Okay, we do plan on putting on another presentation with a near to final plan for your comment. So that that to me just emphasizes that we want to do that. More detail, beat out less technical. So we can bear that in mind. Steve, what do you think? Do we had talked about the potential of seeing if people would be interested in another walkthrough on the detail. Do you think this result here suggests that?
Well, the details we'll be presenting in the actual written version of the plan a description of both the fiscal impact model and then more details on the actual plan for implementation. That will be like a Gantt chart that'll have like task by task. So it's a lot of details in it. We're kind of like at the point that to really kind of understand the next point where you dive deep into the weeds. So that would be a much more complicated discussion and much harder to be able to follow that.
Mm-hmm. Okay. Well, let's certainly talk further about that. And then finally, other steps we've proposed to eliminate the waitlist too detailed, not detailed enough, or about right. So about right carries the day there. And some people are requesting more detail. So I think that will help inform us as to how we present next and how we write up the plan. So thank you.
Okay.
One question we got in the chat was a little bit more information about Interi. And Abby, you didn't spell it correctly, but that makes sense because it's kind of weird. But we can put that in the chat and you could go look at a lot of information about that. So, oh, Heather's typing it in, so.
And what is that? Do we have a link to provide or?
Yeah. Interi.org,
Yes.
INTER, like interactive, INTERRAI.org. And Heather's putting that in the answer to this.
Yeah.
Okay, thank you everyone for your input on that poll, on those polls. Appreciate it. We have about 9 minutes left before we'll close the webinar. I just want to open it up to any other questions or comments now. And I want to encourage people, especially if you found yourself responding to those polls with specific things that you think we could be doing better, please send an email to that address that's up there on your screen. We've just gotten a few comments from last time, and we really appreciate the input.
Okay. An anonymous attendee said that they appreciate all the information presented and everything seems to have been presented clearly with an appropriate amount of detail. The main issue is that it feels like we're talking about issuing more hotel room cards to people when the hotel has been past capacity for years and people are sleeping in a hot tub in the parking lot. Yes, I believe SDS is very concerned about provider capacity and being able to meet that, and that is one of the things that will be highlighted in the plan. Patrick was saying, would you like to, we would like to invite you to speak to our Joint Community and Inclusions Supports, the CISS, formerly the DD Committee and Legislative Council meeting on December 12th. I'll defer that to Tony.
Yeah, thanks, Patrick. I'm not sure if the U is SDS, Steve, but let's talk further about that. I think that we will be hoping, we don't have a date picked out yet for our next webinar, but I anticipate, since the report is due the 20th, that it's going to be in that neighborhood. Steve, don't you think?
Yes, around then, yeah.
Okay.
Okay, and Sandra Heffron was asking about how many other assessment tools have been developed since we reviewed the tools 5 years ago. The major one that was really developed, that I think was partially reviewed on there, but not thoroughly, was the FOSI effort developed under CMS, which is the items are very similar to some of the NRI, but they're not nearly as robust, and they haven't developed it more specifically for the IDD population as has been developed for the NRI in this case on it. There are likely to be more state-specific or homegrown tools on that, but given that the thrust of the effort, anybody who's really developing a new IDD tool and using a lot of research and a strong methodology for doing so is probably going to be basing it off of or expanding it from the NRI effort or from the CMS FOSI effort.
Steve, we're lucky to have you surveying what's going on around the country and keeping an eye on other things that are happening elsewhere. Okay, well, that's our presentation this morning. Again, please follow up with anything in writing you'd like. And I wanted to just say thank you to Steve for helping moderate and answer questions, Andrew for your help, and Lynn, Heather, Jetta, and everybody else at SCS. Appreciate it. And appreciate all of you for joining us this morning and continuing to walk through this process with us. So thanks again, and have a good Monday.
Great. Thank you. And I will be closing out the webinar.